notes. Well, welcome to this MFCA webinar. This is a slightly different webinar than what the MFCA is used to doing. Typically, we have a panel of experts on here to talk about some specific subject related to the fitness industry. This is more of an educational conversation around coaching. So we're going to dive into that. As I was mentioning a second ago, this webinar will be recorded, and we're going to send that out to all attendees after the fact. We'll also send a PDF of the PowerPoint presentation for everyone to have access to, so no need to feverishly take notes. If you do have any questions, unless it's particularly relevant to the specific topic we're talking about at the time, I ask that you please save those for the end of the discussion. We'll have about 5 to 10 minutes left over at the end of the hour to be able to talk through any questions you have. Now, keep in mind, this is a Zoom webinar, which means we won't be able to see you, so you can't speak to ask your questions. Those will have to either be put in the chat or the Q&A. We'd prefer that you use the Q&A for purposes of asking questions versus the chat. Just makes it a little bit easier for me to manage. So with that being said, let me first start by introducing myself. My name is Michael Stack. I am a board member of the Michigan Fitness Clubs Association. I am also the founder and CEO of Applied Fitness Solutions. We're originally an Ann Arbor, Michigan-based fitness company that has locations in Plymouth, Rochester, and still in Ann Arbor, Michigan. I also teach at both Eastern Michigan University and the University of Michigan. And what I'm going to be talking about today is a subject that I am very passionate about, and one that I think is critically important for anyone in any allied health field that works with patients or clients. So this could be personal trainers, this could be nutritionists, certainly this could be other allied health professionals like physical therapists and doctors and nurses. So I think that this is a broader conversation than just getting our clients to exercise one more day a week or take in one less serving of chocolate cake every night. This is a much broader conversation. So as we get into this, I want to talk about a general concept that I think is really important. And it's how I always like to jump off with the coaching conversation. It's what our true job is as allied health professionals. And I really believe it is this concept of flattening the curve. And I always joke about the fact that I feel like I came up with this flattening the curve concept far before Anthony Fauci ever came along. And it's this concept that for us as health and wellness professionals in whatever domain we're in, it's our job to just get people a little bit better. Because getting people a little bit better can have profound differences in their health and their well-being. And I want to use exercise as a way to illustrate this. And so this graph here shows illness and disease on the vertical axis and shows level of fitness. For the purposes of our conversation here, we'll just say this is level of aerobic fitness on the horizontal axis. 1 being low fitness, 5 being high fitness. 1 being low level of illness and disease, and 5 being high level of illness and disease. And what this curve shows that's so critically important is you don't have to take somebody from being a couch potato to being a jack potato to make a significant difference in their health and their well-being or reduce their illness and disease. You just have to take that couch potato and make them a slightly more active potato. And I think that we often miss in our field the importance of this part of the curve, this slope of the line, because this tells us here that small improvements in a low level of fitness confer outsized benefit, dramatic benefit in terms of reduction in illness and disease and morbidity and mortality and improvements in functional capacity. And this is where we get recommendations such as the doing 150 minutes per week of physical activity, which is the current recommendation by the ACSM, the CDC, and the World Health Organization. That's a great recommendation, and it's an evidence-based recommendation. But the reality is that it doesn't mean that 150 minutes is good and 149 minutes is bad. In fact, I would unequivocally say the health benefit derived from going from 0 minutes of exercise every week to 15 minutes of exercise every week is outsizedly greater than going from 135 minutes a week to 150 minutes a week. So I think it's important for us to contextualize the fact that we do not need to take our population that is largely sedentary, deconditioned with all kinds of comorbidities and get them to this level of 5 fitness, because after we reach a certain point, we're asymptoting off. It's a point of diminishing returns. If we could just get people from a 0 doing nothing at a very low level of fitness to a 1 or a 2, a slightly higher level of fitness doing something, then man, we've made a big difference. And for the people that need this the most, I think effective coaching is even more important. So the question is, why start here? Why start with this concept of coaching? This is the first educational webinar the MFCA has done on a coaching or fitness related topic. So why did we choose this one? Well, first and foremost, I truly believe this quote by Teddy Roosevelt is unequivocally true. It is that people don't care how much you know until they know how much you care. I think many of us figured this out when we were very early in our careers in fitness, when we thought we knew everything and focused on spouting out all of these complex terms, and people really didn't give a damn because they wanted to know that we cared about them. And my other quote that I love, and I don't know if there's many slides and presentations where you will see a quote from Teddy Roosevelt and a quote from Mike Tyson, but this presentation has it, is everyone has a plan until they get punched in the face. And Tyson famously said that about one of his opponents in a fight. And I also liken that quote to what I was like early in my career as a fitness professional, where I was armed with these great plans, these great knowledges, and I was going to change the world. But without realizing it, my clients punched me in the face over and over again because they weren't implementing my great plan. So the question was, how do I get people to know that I care? And how do I get them to actually implement a plan, maybe not that I create, but maybe a plan we co-create? So I think that these first two slides are some good context for the discussion we're going to get into. And I think that really, in a lot of cases, coaching skills, the ability to coach, and we'll define what a coach is in a moment, the ability to coach effectively allow us to bridge the gap. And we're going to talk about that gap, but largely the gap that we and our clients and our patients have can be characterized by a gap in values and a gap in expectations. And depending on your age, there also could be an age gap, meaning you're considerably younger and somebody you're working with is considerably older. There's an age gap there, but for the purpose of this discussion, we won't really dive into the age gap as much as the values and the expectation gap and how we bridge those. Looking at the values gap, obviously as allied health professionals, no matter what you're doing, you highly value health and health-oriented activities. You just do, or you wouldn't have gotten into this. Now, the clients or patients that we work with don't necessarily place the same value on health or health-oriented activities. If they did, they probably wouldn't be coming to work with us in the first place. In fact, they may even be us. The expectation gap is that we as allied health professionals, we know that we place fitness and health in high priority in our life. It is a high priority. It may not be the number one priority, but it's up there. Improving health and fitness, we know takes time. We've been educated in the chronology of physiological and anatomical adaptations. We know that there's no overnight fix, contrary to what popular media will tell you. And we believe that we have all the necessary expertise to be able to help our clients and to meet their needs. Those are our beliefs. So health and fitness is a high priority. We know that it takes time to improve it. You can't undo 10 years of bad eating behaviors in a month, despite what popular media will tell you. And we truly believe we have all the know-how that it takes to get someone to achieve their health and their fitness goals. The average client or patient thinks really, really differently. They think that self-care cannot be a high priority. They do not subscribe to the adage that you need to put your own oxygen mask on first before helping others. They're running around constantly putting oxygen masks on other people to their own detriment. They believe they can get healthy quick with minimal change to lifestyle. We certainly see this popularized in the media. I guarantee you've never seen an ad on Facebook that says lose 4 pounds in 4 weeks sustainably. No, it's always lose 20 pounds in 4 weeks, get in the best shape of your life. It's some outlandish claim that we know as health professionals aren't true, but permeate the consciousness of our culture in a way that has them bring very unrealistic expectations to the table with regard to health and wellness and fitness-oriented activities. And if you've been in the industry for longer than 6 months, I'm sure you've experienced that struggle of there being a gap in expectations. And lastly, the public is also very skeptical. They're particularly skeptical of people that tend to ascribe to more scientific-oriented theories, which unfortunately you think the opposite would be true. But all of us know well that when people ascribe to scientific theories, the answer to every single question somebody will ask you is, it depends, right? Answers that are accurate and science-based are nuanced. That's not what they're getting in the media. What they're getting in the popular media and in their Facebook threads and in Instagram is they're getting that it's always this way or it's never this way. And we know full well that's not the case. And when we say that, because it's the appropriate professional thing to say, we need to realize that our clients in those cases will have some doubt. So there's this expectation gap. We have a values gap and we have an expectation gap. And we have to bridge those gaps in order to effectively communicate, get buy-in and trust from, and be able to effectively work with our clients. And these gaps, from my perspective, at least what I've seen in my professional career, which now spans over 22 years in commercial fitness, is if we can't bridge these gaps, then it's very difficult for us as allied health professionals to empathize, set proper expectations, and build strong relationships. And if we can't do those three things, and we need to do all three of those things, these aren't things that you can do one or two of to be an effective coach and to facilitate effective behavior change, then we're really going to butt up against a challenge when working with our clients. Now, the flip side to that is, if we can't somehow engender those three things, then our clients have a hard time trusting, communicating openly, and making lasting change. So we have to figure out a way to bridge these gaps effectively. And I have a view of how to do this that I think many who are in the field are aware of, maybe some tangentially so in some cases, but I'm very, very hopeful that I can consolidate it here in a way, in a framework that might be actionable for some of you. The first step to overcoming any problem is realizing that it exists. So I always really challenge fitness and allied health professionals to reflect on these gaps and how these gaps could be barriers to communication and trust building with clients. The next thing is, after you're aware they exist and you're realizing that, is to be aware of them in every interaction and communication. The lens that you filter everything through as a coach needs to be the ability to empathize properly, set proper expectations, and build strong relationships. So that is your lens. So continually asking yourself and reflecting on the fact that you're doing that or not, I think can have a pretty profound difference in your ability to truly connect with clients. And then keep in mind things that we talked about earlier. People won't care how much you know until they know how much you care. And then what result do you want to create? That's a favorite quote of mine from a business leader that I've actually worked with, when he talks about organizational development and positive organizations, but I apply it to working with my clients. And when I think of what result I want to create with my clients, I want to create someone who has self-agency and autonomy to make changes and maintain those changes well after I'm gone. Eventually, I want to render myself useless to my client. And if I have done that, if I'm able to cut the umbilical cord properly, then I've done my job as a coach. So where does this start? Well, it starts by becoming more emotionally intelligent. And this is something we hear about, but I don't know if we often talk about it to the depth and degree that's necessary to really effectuate change in emotional intelligence. There's a long, wordy academic definition of this, but basically it is your social or emotional intelligence as contrasted with your intellectual intelligence. And really the genesis of this came from some studies that looked at business executives and their level of performance in a business setting relative to their academic proclivities, standing, and degrees. And basically what the research found, and this was in the early 70s, is that the ability to perform and execute at a high level and be successful in business domains was very poorly correlated with academic achievement, GPA, the institution where one got a degree from, such as an Ivy League school, and correlated very highly with emotional intelligence. So it turns out that what you know is less important than how you feel and how you interact with people. And there are 4 factors that affect EI to a degree, or there are 4 factors to consider with regard to EI. And it's the perception of emotion, the ability to reason using emotion, the ability to understand emotion, and the ability to manage emotion. Now, in an hour-long webinar, I'm only going to be able to dive so deep into these, but I think at least putting them out there on the table for you to consider hopefully provides some food for thought for you to dive a little bit deeper into your own emotional intelligence, evaluate it, and then make appropriate changes where needed to be a more effective coach. And there's a seminal book on this, and some of you may be familiar with this book, Emotional Intelligence by Daniel Goleman. Daniel Goleman was an author that published this book back in 1990, and it gets into a number of areas related to emotional intelligence. And this has been adapted to leadership, management, coaching, healthcare. The list goes on and on and on. I highly recommend this as a read for those of you that are looking to dive a little bit deeper into this. I feel as if this is almost a requisite book for anyone going into any professional occupation that involves interacting with other people. Maybe if you're a nuclear engineer who's in a submarine somewhere deep below the Arctic surface, maybe you don't need emotional intelligence. But I think all of us need emotional intelligence if we're interacting with other human beings, because that's what drives the efficacy of those interactions. And the domains and competencies in emotional intelligence can basically be broken up into 4 categories: self-awareness, self-management, social awareness, and relationship management. Now, I'm not going to dive too deeply into each of these categories simply because we don't have a lot of time. The subsequent slides have definitions and have some ways that we can almost quantify and qualify each of the different categories. But for the purposes of this particular slide in this discussion, I want to make one thing abundantly clear, and that is there is a hierarchical progression to emotional intelligence. And that is this: you can't effectively self-manage until you're self-aware. You can't effectively have good social awareness until you can self-manage. And you can't manage relationships until you can be socially aware, self-manage, and then be self-aware. And what I'm getting at with this is if you look at the far right of this chart, relationship management, you see all the cool things that people are interested in focusing on with regard to coaching. They want to influence, they want to coach and mentor, they want to manage conflict, they want teamwork, they want to do all of these fun things on the far right here. But very few people are willing to actually address these things on the left part of this grid. So I say that to say that if you are interested in really becoming an effective coach or a mentor or any leader for that matter, you need to focus on the left side of this grid first, starting with emotional intelligence and then working your way through the right, to the right, I should say. You cannot shortcut this process. There is no cheat code. If you don't start with self-awareness and progress, then the likelihood that you will ever optimize any of these, or maybe not even optimize, the likelihood that you'll ever even do any of these to a marginal degree of effectiveness will be significantly limited. Now, as I said, there are slides here that define each one of these, and I'll let you look at these slides when I send the presentation out afterwards. But if you are really looking to dive into this and you're looking for a place to start, I highly recommend starting with emotional self-awareness. And a lot of times this just comes by the way of journaling, being able to pay attention to your emotions, noting what things trigger you, noting how you respond. This is a very subtle and nuanced type of activity, but it's one that could pay significant dividends. And a very easy entry into developing greater emotional self-awareness would just be to spend some time every day doing some brief journaling. Now, I know journaling is not for everyone, but even if it's 3 or 4 or 5 minutes at certain points during the day, typically I like to do journaling in the middle of my day and at the end of my day. I find that it's good for me to capture my morning interactions midday and then my afternoon interactions later in the day. But however you want to do it, even if it's right after an emotion comes up, or maybe you don't feel like you handled something well emotionally, taking some time to journal it, to get it out of your head and onto paper or onto a computer screen can be profound in terms of your ability to understand how your emotions are driving you and for you to just be aware of them. Keep in mind that our emotions are triggered far before any of our cognitive processes are. From an evolutionary standpoint, the emotional centers of the brain are more primary than our intellectual and our cognitive centers, both from a evolutionary development perspective, but also in terms of chronology. So you will have an emotion far before you have a thought, which means in many cases we can act on an emotion, or we can react without actually intellectually contemplating what that reaction is. So journaling can be incredibly helpful in this regard. Again, there's some other definitions here that you could go through. The goal is just more to introduce this concept as much as anything else. Relationship management, this is the creme de la creme. This is where we all want to get to. We all want to be able to influence, coach, and mentor, manage conflict, inspire with our leadership, and work effectively as a team. But none of this happens unless the lower levels of the hierarchy get addressed first. There are different ways to have your emotional intelligence assessed. One validated assessment that exists is something called the Emotional and Social Competency Inventory. This is an assessment that you can get done for anywhere between $250 and $500, which I know seems quite expensive, but if you think about it, we spend money on all kinds of things all the time that only make marginal improvements in our ability to be more effective in our profession. And I would venture to say that getting your emotional intelligence analyzed using a validated inventory and then getting some feedback on how to improve it can be exponentially more beneficial than sitting through a webinar like this or going to another conference to learn another exercise technique or another technique for treating a patient. This really gets to the linchpin of effectiveness for any allied health professional that is working in a patient-centric or a client-centric setting. Which brings up the term client-centered coaching. And I used this quote earlier. It's what result do you want to create? As I said, I want sustainable health behavior change. I want to foster self-agency, self-efficacy, autonomy, independence, and empowerment. I want to make myself, as a coach, I want to make myself not necessary anymore. I want to make the client the center of attention, which, man, I work in the fitness field, and we're all here as fitness professionals. Our field seems to decidedly not be about making the client or the patient the center of attention. It seems to be a lot about making us as the professional the center of attention. You don't have to look any further than Instagram than evidence of that. So what I'm saying here is we need to shift the spotlight. The spotlight is not on us. The spotlight is on the people that we're working with and should always stay there. We want to be less of an expert and more of a coach. And we're going to define what a coach is in a second here. But I do want to touch on the concept of expert first. I don't actually think anybody likes an expert per se, because an expert engenders or connotes to me kind of this know-it-all that is kind of looking down their nose at you and makes you feel inferior. I think people love individuals who demonstrate expertise, but they do so in a collaborative way. They do so in a humble way. They don't do so in a know-it-all area type of way. So we're talking about being less of an expert and more of a coach. And a coach is all of these things. They're a collaborator. Sometimes they're a facilitator. They're a supporter. They're an educator. They're a resource provider, and they're a sounding board. As a coach, you wear multiple different hats at multiple different times. Truly skilled coaches know when to take off one hat and put on another hat. And we've all had the experience a lot of times in relationships. I know as a guy, I tend to be a problem solver. Like I want to be, in a lot of cases with regard to this coaching paradigm, I want to be a facilitator. I'm like, you tell me something's wrong, the person I'm in a relationship with, you tell me something that's wrong, and I want to facilitate a solution to the problem. Well, my experience has taught me that rarely does the person I'm dating want me to be a facilitator. They're actually just interested in me being a sounding board. But there ends up being dissonance in that conversation because they want a sounding board, I want to be a facilitator, and I'm acting as a facilitator, and they're shutting down. So I think it's important to realize when to take off one hat and when to put another hat on. And truly skilled coaches with a great level of emotional intelligence and experience know when to wear what specific hat. And I think it's important to note that the health coaching model is not diagnosis prescription. And I teach an exercise testing and prescription class at the University of Michigan. So whenever I bring this up, I always feel as if I'm challenging the very foundations of a class that I teach in academia. But hear me out on this, because I think you may, if you don't agree, you may at least become a little bit more open to my perspective. Diagnosis prescription assumes pathology. It assumes something is wrong that needs to be fixed. And I think that is not only the wrong approach to take from a health coaching perspective, but I think it is a greatly counterproductive approach to take. Health coaching assumes there's some degree of wellness that already exists in our clients. And if you think about it, if a client has walked through our door to talk to us, then they have a high enough level of health and wellness to be able to get out of bed in the morning, put their clothes on, get in their car, drive there, and walk through our door. The number of health-oriented activities functionally that have to take place for that to happen is almost more than we can count. So there is wellness already there, no matter how diseased or comorbid the individual is, there is a level of wellness that we can cultivate. And our job is to enhance the wellness that exists within somebody, not to remove pathology and replace it with wellness. That's never how I view this. And that may be a subtle distinction for many of you, but I believe that coaching and a strong bond and connection can only be made when we start with the level of rightness with someone rather than focusing on their level of wrongness. It's very much an appreciative inquiry-based approach. And for those of you that have studied appreciative inquiry in the business domain, it's a very much an approach that's based on appreciative inquiry. It's starting with what's right and what's good rather than what's wrong and what's broken. Because it turns out what you're looking for and the questions you'll ask, you'll often find. And what I'm saying is, let's find the strengths that an individual has and let's build on those rather than identifying weaknesses and trying to eradicate those. I believe everyone has what they need inside of them to make the changes they want to make to be healthier. It's just our job as coaches to bring them to the surface and then to organize them for the client in a way that they're able to effectively make change in their life. Acronym that I absolutely love, RESPECT, recognize the inherent worth of all human beings, eliminate bias and stereotypes. We're going to talk about that in a moment. Speak with people, not at them. Practicing empathy, we touched on that earlier. Empowering change, creating trust, and treating clients as an expert on themselves. So to kind of bring this whole coaching conversation together into a head, I want to talk about my 5 coaching best practices here. The first is be present and be focused. You absolutely cannot develop a strong, trusting relationship with somebody if you're not highly present and focused with them in the moment. And I think many people have experienced this during our level of highly connected or always connected society with smartphones, right? We all have our phones sitting there. We've all been in conversations with people where they're talking to you and then they're looking at their phone and they're talking to you. And that really gives you the sense that maybe not that you're not important, but certainly that something else is more important than you. Excuse me. And there's nothing that degrades trust any faster than that. So being present and being focused and setting your environment up so you're present and focused and dialed in a very client-centric way with the person you're working with. Treat each person as a unique case individually. It's maintaining this mindset of curiosity. It becomes very easy in our industry to kind of slot people into different avatars. Oh, this is the middle-aged overweight woman that has 4 kids. She doesn't have time to exercise. This is the adult executive who's type A that's really stressed, or whatever avatar you want to create. And what you find that if you do that, it's the subtle nuances that make a relationship with somebody special as well as a program effective that get lost. Sure, 80% of our exercise programs are probably going to be the same for almost everybody we work with. The difference between not just a good and a great program, but the difference between a safe program and an unsafe program, an effective program and an ineffective program, always lie in that 20% that is different between people. And I'm here to tell you, again, after 22 years of experience with this, plus looking at a lot of the contemporary research, that it is the ability to individualize to that high degree, to be curious around that 20% that is different with people, more so than thinking about the 80% that's the same, that results in a more effective and wholesome experience for our clients. So always maintaining that mindset of curiosity in your questions, in your assumptions, in your biases, and how do you actually make sure each client is treated as a unique individual. Striving for collaboration, always making sure that you and your client are co-creating the program, co-creating the process rather than you just unilaterally creating it on your own. Again, we have expertise about fitness and nutrition and things that are exercise related. Our coach is an expert, or excuse me, our client is an expert on their own life. And our job is to take our expertise and blend it with their expert understanding of their life to co-create an effective program. And it's just not a unilateral top-down prescription. Now, you can try that, and I certainly have during my career, and that is always when my client metaphorically punches me in the face by not implementing this great plan I put in place. So we're striving for co-creation here. Avoid being the expert, and there's several things that go into avoiding this expert stance. It's asking permission before you give advice, which I know seems counterintuitive to many of us in the fitness field, but it's, hey, would you be interested in learning more about this? Or would you be interested in unpacking that? Or would you be curious to know what the research says about this? Don't discuss things that have worked for you. This is a really, I think, nuanced point to consider. Often as fitness professionals, we will talk about what works for us and try to superimpose those activities tactically on our clients. As an example, I wake up every day and I have a strawberry banana protein smoothie. You'll love it. It's a great breakfast. It's simple and easy. I think you should give that a try. What you're saying is, hey, this thing works really, really well for me. You should try it. What your client is hearing is, well, of course I'm not going to do that. I'm not a mid-20s something, jacked male bodybuilder that lifts 6 days a week. So yeah, that's great for you, but that's not me. Now, if you still want to say that same thing to your client, you could just replace you with one of your clients. Like if you think something is particularly a good idea, you might want to say, I've had many clients that have tried a strawberry and banana protein smoothie for breakfast. They love the way it tastes. It's simple. It's easy. What do you think about giving that a try? Totally different way to approach it than to say what works for you. Because as soon as you say your other clients have tried it, then there creates a level of generalizability and familiarity that your client will actually say, okay, well, people that are like me are doing this. And quite often, as humans, we are risk averse. We don't want to be the first person to take a chance on something. And by letting them know that other people have done it, that can confer significant benefits in terms of making them feel more comfortable. And then lastly, keep terminology at an understandable level. The longer you go throughout your career, I think the better we get at something like this. I think when we first started our careers, we're so concerned with convincing ourselves that we know what we're talking about, that we use very, very complex terminology. If you can't explain it to your client like you'd explain it to a third grader, you probably don't know it as well as what you think. It's the famous Mark Twain quote, which is, I didn't have time to write you a short letter, so I wrote you a long one. Try to keep terminology understanding. And then lastly, use your expertise to guide a client or a patient. This doesn't have to be, again, you just unilaterally putting on the prescription and saying, go do it. But this also doesn't have to mean that the client is just saying, hey, I want to go do this and to hell with what you think, which it's rare that a client would say that, but it is finding that middle ground. It's finding that gray area that exists between what you know is most effective for helping this individual reach their goals, and then what actually works within the context and confines of that individual's life. And those can be two profoundly different things. And it goes back to number 3. It's all around collaboration. So in summary, present and focused. Be in the moment with your client always, no matter what else is going on at that current time, before that, after that, be in that moment. Maintain that mindset of curiosity, treating each client and patient as an individually unique case. Striving for collaboration by avoiding being the expert and using your expertise to guide. We put guardrails on people. We do not put handcuffs, or we do not bind people to a specific path. We put guardrails and we co-create the operation within those guardrails. Now, there are some coaching communication skills. And again, all of these things can be very, very in-depth in terms of their explanation. But I want to go through them briefly just to put some context around how you operationalize being a coach, because we've just talked about it philosophically. And while a philosophical conversation around how to be an effective coach is great and it's nice, we actually need to figure out a way to effectuate this in the real world with our clients. And we do that through the R.E.S.P.E.C.T skills: open-ended questions, affirmations, reflections, and summaries. And as I talk through these, I think you're probably going to realize these have been used in conversations you've been in before, maybe by yourself as a coach, but also by coaches or therapists that you may have worked with. Open-ended questions. For these, a lot of open-ended questions can be handled in a pre-appointment questionnaire or email, particularly when you're first meeting with a client. You want to avoid bombarding somebody with questions right out of the gate. And a lot of these can be done by just a simple questionnaire that the client fills out ahead of time. If you have time to review it, that can lead to additional open-ended questions, which is normally a more effective way to go about that, rather than bombarding them with 75 questions the second they sit down. If you give them too many open-ended questions, they'll kind of feel like they're on the witness stand, like they're on trial, and you really want to try to avoid that type of emotional constraint on the client. We know that open-ended questions start with things like how, what, why, tell me. Do be careful with the why. I think sometimes that can be judgmental and accusatory if you don't use the right intonation and inflection in your voice. So just be aware that, why can't you do that is very different than, well, why can't you do that? So just be aware that question does carry a little bit of emotional charge to it and valence if you're not cautious. And as I said, careful with too many open-ended questions. Typically, those will put the client in a passive role and make the coach seem a little bit more like an accusatory expert. We're going to talk about reflections in a moment. And typically, a good cadence is for every one open-ended question you asked, you should strive for 2 reflections. As you're getting into this, it might be more realistic to have one open-ended question with 1 reflection. Whatever the case may be, really try to avoid peppering somebody with question after question without reflecting back to them a summary of what they're saying in between. All kinds of open-ended questions. Tell me more about that is just a very, very simple way to engage in open-ended questions. One of my favorite open-ended questions to ask people is, tell me what the most important thing is to know about working with you to ensure that you're successful in achieving your goals. Tell me the most important thing that I should know about you that will help you reach your goals. That is a critical open-ended question. You can glean so much information from the answer to that one question. So bear in mind, that's a good way to approach an introductory session if you're wondering, okay, how do I get to the heart of what's important to know about somebody? If you built up some trust and rapport leading into that question, normally that question can provide you a lot of insight. All kinds of different open-ended questions you can use. Change rulers. How ready are you to lose weight on a scale of 1 to 10? How interested are you in losing weight, scale of 1 to 10? I love these change ruler questions. They really are an effective way to be able to get an idea of where somebody's at. And then you can ask some scaling questions to uncover either reasons to change, we call change talk in motivational interviewing terms, or reasons not to change, or barriers. So as an example, how motivated are you to lose weight? Well, I'm a 7. Awesome. Tell me why you're a 7 and not a 6. That's going to result in change talk. That's going to get that person to tell you all the reasons why they can make the change. Tell me how important it is for you to lose weight. Well, it's a 5. Okay, well, that's somewhere in the middle. Tell me what makes it a 5 instead of a 6. Then they'll start to talk to you about barriers. And those are equally as important to know. You have to be careful with talking about that because that can talk the client into staying the same. But nevertheless, if you can at least have the conversation around barriers and bring them to the surface, you can come up with some type of plan to address those barriers. Silence. As the old saying goes, silence is golden. And I truly believe that with regard to open-ended questions. If you ask a good open-ended question, you should have to be silent for a moment because it's going to take a second for your client or your patient to actually answer that open-ended question. So as soon as you talk, shut up. And I know that's such a hard thing to do, but if you don't stop talking, your client is not going to have time to think, process their answer, and respond. In that silence, your goal is not to be thinking of the next thing you say. It's just to be very present and very in the moment with your client, waiting for them to respond. And after you've asked a great open-ended question, then don't say anything until they've talked. An old saying in sales is the first person that talks loses. And this is very, very true when you're trying to uncover a deeper truth or deeper insight on somebody with an open-ended question that's very important and deep, is you need time to give them time, I should say, to process what their answer is going to be. So good silence gives you time to think, certainly about maybe what you just asked, but also just kind of waiting for their response. Gives the client or patient time to think, and most importantly, gives them time to answer. We need to take into account an individual's processing speed, and normally it doesn't happen instantaneously. Moving on with the OR skills, affirmations. These are statements about one's character and values that acknowledges their strengths and their efforts. And they really highlight the client's abilities and positive efforts. This is, again, going back to this concept of we're starting with the rightness within somebody, not the wrongness within that person. So in saying that, it's very important to be able to recognize consciously on your part someone's strengths and then affirm those verbally to that individual. Doing so helps the client gain self-efficacy and confidence. They actually start to believe in their ability to make change. And it also engenders a great degree of trust. You've probably never struggled to develop trust with someone who's constantly affirming in a genuine and honest way your positive attributes. If somebody's telling you the good things about you all the time, inherently, you're going to trust that person more than the person who isn't telling you any of those things. They don't necessarily need to be telling you bad things, but if they're just not telling you anything at all, that no way is that going to facilitate as much trust as if they're constantly pointing out your strengths and your strong suits. You always have to be looking for what the client's right. You always have to be looking for what they accomplished. And they always have to understand that they can use these tools. These become facilitators of the client achieving their goal. If the client achieved one thing in one domain of their life, there's absolutely no reason why they can't take the psychological and emotional skill set and scaffolding that allowed them to achieve that particular thing, maybe a college degree, maybe raising a family, and they can't shift that scaffolding and that framework over to be successful with their health behavior change. They empower the client, they encourage persistence, and they decrease defensiveness. All very, very critical elements in building trust early on in a relationship. In an affirmation, the coach has to interpret what the client is saying, and it's making an educated guess about what kind of positive effort or value the client is displaying in that situation. We like this to be focused on behaviors rather than attitudes or decisions, something that is very, very concrete and tangible. Hey, you graduated from school with your MBA. That means you obviously must have a lot of self-discipline and a lot of intelligence. I think that's a fair extrapolation to be able to make. You do need to play it safe by picking characteristics you're sure somebody possesses. Nothing can degrade the affirmation process more than trying to affirm a strength that the client doesn't perceive as a strength in themselves. Then there starts to become dissonance in the relationship because they get the idea you just simply don't know them all that well. And this is difficult to do initially with the client, but as you get to know a client a little more, the utility and the depth and the breadth of this greatly increase. So be persistent with it and stick with it because it does confer significant benefit. Reflections. Reflections are a form of active listening. We go back to open-ended questions. We talked about for every one open-ended question, trying to aim for a minimum of one, if not two reflections. It allows the client to feel validated and understood, which that creates a great degree of rapport and trust, because we all know this from having conversations with people. If you say something and then somebody reflects it back to you more succinctly, but still accurately, subconsciously at the very least, but sometimes even consciously, you feel like, wow, this person really understands me. They get me. So this concept of reflecting is taking a long client statement. Maybe the client talked about their family getting in the way of them achieving their fitness goals. They've gained 20 pounds over the past 20 years as they've been raising their kids. They're worried about not being able to be active with their grandchildren. You might say something like, you've really emphasized working with your family a lot over time at the expense of your own health and your fitness. And then that's it. There's no question mark at the end or anything like that. It is a succinct statement that summarizes what the client said. It helps the client feel validated and understood. It is you making an informed guess about what the client says, and your guess can really never be wrong, because either your guess is right, which makes them feel validated, understood, and allows them to hear from a different perspective what they said, or it could be wrong, in which case the client gets to clarify what they said on a deeper level, which gives you an accurate understanding of that, and it gives them the ability to restate it one more time to just further solidify and crystallize what their thoughts were on something. Because sometimes people have a perception of something, or they have a thought on something, but it's only in their head. And the first time they say it, it doesn't exactly come out all that clearly. And sometimes that creates ambiguity for themselves. So by reflecting something back to them, it allows them to hear it from another person's perspective after they've just said it out loud, which either validates what they've said or brings up the issue of them saying it in a way that is not entirely accurate and forces them to clarify it a little bit more, which is great not only for your understanding, but also for their understanding. And getting the client to think deeper is so important. I think most people, when they come to us, have probably thought, and this is a grossly overgeneralized statement, but most people have probably thought about their health behavior change on a decently superficial level. My experience is that only 3 out of 10 max tend to think about their health behavior change on a very, very deep level prior to coming to a health, wellness, and fitness professional. So good reflections that allow people to think deeper about the things that they say, and therefore the things that they think, which have probably just been bottled up in their head for years and years, is a great way to help them work through ambivalence, but also provide a stronger nidus of motivation to make change. Reflections are statements, they're not questions. You're not putting the question mark at the end. You're making a statement and they're concise. They're never longer than what the client originally said in their statement. A goal for me is always to take whatever the client said and try to reduce it by 75% into a short summary. It's just not what a person says, but it's what they mean. So you're adding meaning and context to what you're stating back to the client. And you could normally open with, so you feel like you're wondering if, it seems as though you are, something along those lines allows you to lead into a reflection. When do we reflect? Well, you can and should do it at all points in time in a conversation. But critical times to do it are when you first meet a client, because that's when you're looking to develop the most credibility and rapport. When you hear change talk, when the client talks about all the reasons to make change. Or on the flip sides of it, when you hear ambivalence, when you hear the client not being so sure about making a change, being able to reflect that back to them, hear that, and then work with them to help resolve that ambivalence out loud. And you're not doing it by trying to convince them to not be ambivalent. You're simply doing it by listening to what they're saying and reflecting it back to them. And there's this kind of ping pong approach that happens that allows you to really help the client work through the thoughts, the emotion, the mindset that get them away from that ambivalent position and to more of a committed path of action. And then lastly, when you hear sustained talk, sometimes it's important for you to reflect back to a client when they're talking about staying the same, just so the client has the benefit of hearing it from an outsider's perspective, and they can truly reflect on the fact that at this point, they're not really willing to change that component of their behavior. Last thought on reflections is that no reflection can be wrong, so don't overthink it. Worst case scenario, you reflect back to them something that is incorrect, and then the client corrects you, which gives you the correct understanding, but also gives them a deeper understanding of the language that they need to use both externally and internally in their own mind to really encapsulate in a succinct fashion their feeling on something. And they always demonstrate empathy and desire to understand the client. If you are reflecting back to somebody and you're working hard to really understand what they're saying, that certainly suggests a level of enhanced empathy, which is one of those core components to building trust if we go back to the emotional intelligence rubric that we talked about early in the presentation. All right, lastly, and appropriately so, summaries. It's a recapping of what the client said. Usually we do these at the end of a session or at the end of a topic in a session. There's all kinds of benefits to a summary. They give a client a bird's eye view of key information that was shared in a very succinct way. It also gives them the opportunity to hear ambivalence on one side or sustained talk, or their genuine desire to change on the other side. It certainly provides evidence that you're listening, and it helps to organize the client's thoughts and feelings. So as an example, client may go through a long conversation about why they haven't been able to lose weight over the course of the past 20 years. You guys have talked about a number of things, and you've decided that that individual is going to do 3 days a week of 30 minutes of walking at 75% of their maximum heart rate. You may say something to the effect of, so just to go over what we talked about here, you said you've struggled to really maintain your exercise routine because you've been such a dedicated mom. We talked about the easiest way for you to get physical activity into your life would be to do a 30-minute walk 3 days a week after you drop your kids off to school. And we're going to aim for 75% of your maximum heart rate when you're doing that. Did I get it all? Now, this does end with a question. Unlike a reflection that doesn't have a question element, the summary does end with that question mark to allow them to be able to clarify any gaps in the summary that might have occurred as you were stating it back to them. Now, all of these skills take practice. They all do. Open-ended questions, affirmations, reflections, summaries, they all take practice. So I strongly encourage you to practice these things, because the more you practice them, the better you will get. Meaningful summaries, I think certainly there are quick and dirty ways to do a summary. There is, hey, we talked about you doing 3 days a week of walking for 30 minutes at 75% of your max heart rate. Did I get it? And while that's okay, adding more context to that and adding more contour to it, I think can really help the client feel understood and connected to you. So talking about the emotional elements of it, talking about some of the underlying drivers of it and some of the values that are involved in why people are doing something, in addition to the tactical thing you expect them to operationalize with your program, I think that can make a profound difference in really truly connecting with somebody. And typically these start with, let me see if I have it all. Let me take a step back for a moment and look at all the pieces. I'm noticing some themes here. Again, I'm sure that if you've been in any type of a coaching relationship before, you're used to people using terminology like this to encapsulate some type of summary of a conversation. And then we normally end it with, how did I do? Did I get it all? Did I miss anything? What else? This does have a question mark at the end. And again, going back to that silence here is golden. After you provided a good summary, and the more meaningful it is and the more emotional valence it has to it, I think the longer the silence needs to be, give the client a moment to actually be able to answer. You can summarize really at any point in time you feel appropriate, but certainly do it to communicate interest and understanding, highlighting ambivalence and reinforcing change talk at transition points. Sometimes that's very helpful. You've maybe talked about the outside of the gym exercise component. Now you're going to talk about the inside of the gym exercise component. Maybe it's to transition to, maybe it's to get the client back on track. Maybe the client's gone off into left field talking about gardening at their house or something like that, and you want to bring them back. And then finally, to wrap up a session, to bring it to a close. I certainly think at minimum, you should be talking about a summary at the end of the session to ensure, at that point, you've effectively wrapped up the things that need to be handled for that session, and the client can go away with some type of definitive plan. And ultimately, to take it a step further, it may be helpful to actually document that summary some way, somehow, in either a physical form or an electronic form for the client to take with them, or at least be able to reference. Now, there's some other slides in this presentation that talk about motivational interviewing, and I certainly recommend you look at these slides. I think they're helpful. I knew I wouldn't get to them given the short nature of the time we had to talk today, but look through these slides on motivational interviewing, particularly the principles of expressing empathy, developing discrepancy, rolling with resistance, and supporting self-efficacy. The practical manifestation of the R.E.S.P.E.C.T skills, I think, is best encapsulated in the framework of motivational interviewing. So if you're wondering, how do I put these into action within a evidence-based framework, then I think that's where motivational interviewing comes in. There are some great ways to clarify misinformation, and I have a couple of slides in here on that because we often run into misinformation. So learning how to use this elicit, provide, elicit context can be very helpful. I think these slides are pretty instructional and quite straightforward. So I think looking at this could benefit you in terms of how you are effectively able to manage someone's misunderstanding of information that exists out there, which we know is infinitely abundant, unfortunately, on the internet, and how to do so in a tactful way that preserves your client's self-efficacy and the trust within your relationship, but also corrects for the misunderstanding. With regard to motivational interviewing, ultimately, if you do it right, we've mentioned these terms a little bit throughout the conversation, it either results in talk to stay the same or talk to change. And your job as a coach is not to tell the client they need to change, but for the client to tell themselves that they need to change. That is change talk. That is the tangible outgrowth of effective motivational interviewing. It's the thing that operationalizes the conversation into action. There are all kinds of resources out there on coaching. This is just a short list. There are some certifications, Well Coaches, ACE Health Coach certification, and the National Society of Health Coaches, all great certifications. These are books that exist. Motivational Interviewing for Fitness and Nutrition and Motivational Interviewing are great books that dive into MI. No Sweat, which is a book written by Michelle Seeger. Michelle sits on the R.E.S.P.E.C.T Board of Science and Medical Advisors. She's actually a professor at the University of Michigan. An amazing, amazing, amazing book. You can get it on Amazon. It's $15 or $20. I highly recommend it. Michelle is really, in a very simplistic way, quite articulate in the framework that she presents of how to move people towards a more physically active lifestyle. So I highly recommend that book. It's an easy read. And then the wellness coaching book that Well Coaches uses, that's available on Amazon as well. Wellness Coaching for Lasting Change. Highly recommend that. Well, that's all the time we have for today. We have a couple of minutes for questions. Before I stop the recording and open it up to questions, here's my contact information. You see my email there. If you do have any questions, please feel free to reach out to me. Again, this was brought to you on behalf of the Michigan Fitness Clubs Association. As many of you may know, we are the state trade association for gyms and fitness centers, and we are working very hard to not only lobby for us to stay open under no restrictions during this COVID period, but more importantly, we're looking to a greater vision for our industry. We're looking to move to a point to where we take the state of Michigan from the top 10 in obesity rates in the country to the bottom 10 in obesity by 2030. We're looking to advocate for our industry and looking to bring us onto the healthcare continuum as expeditiously and in as engaged of a fashion as we possibly can. We certainly need your support to do this. If you want to go to the MFCA website, please do so. I'll be sending that out afterwards. You can link directly to it. We're also on social media. Please look at our information. Please come to our webinars. We'll have a webinar coming up next month on legal liability and intellectual property concerns related to virtual fitness. We're all doing virtual fitness now, and there are different legalities that need to be considered with regard to that, not only the liability aspects, but also the intellectual property rights in terms of who owns some of that content and how to keep yourself protected. And really, as the MFCA, we're here to serve you as our constituents in the health and fitness industry in the state of Michigan. So if there's anything you want to know about the MFCA or any suggestions that you have for webinar topics, please reach out to me via email. We're more than happy to take any suggestions into consideration, because ultimately we are your state trade organization, and we are only as effective of a governing body as what we can be for you. So please do not hesitate to reach out to us. If there's anything that we can do for you, we're more than happy to help. So thank you for joining us today. I will stop the recording for all of those of you that are watching this after the fact. And for those of you that are still here, if there are any questions, just please go ahead and